Hello everyone, you're almost welcome for today's session. I'm now Safinah, part of the blended learning collaborative team. You're most welcome, and today we're interested in looking at the bed appliances. And bed appliances are the accessories which are used in different types of beds in a hospital setting. So we shall have to look at one by one with its rationale or its use. I'll start with an airing. This helps to relieve pressure of the buttocks from the bed. I'll go to a hot water bottle. They can be of different colors, red, pink, blue, name it. So a hot water bottle is helpful in a way that it can help to relieve pain, yes, or to improve on the warmth of a patient. For example, in case a patient is having abdominal pain, you can put your hot water, wrap it in a cloth, and apply it on the abdomen like this. Or in case a patient is feeling cold, you still put in warm water, wrap it in a cloth, and put it next to the patient's body. Then we have sandbags. These ones help to prevent jerking in case of an amputation, or when the patient is having an amputated limb. You can put it on either sides, and then can prevent jerking of the limb. Next are the bed blocks, or you can call them bed elevators. These ones are used to elevate the bed, like the word goes, elevators. In case you want to lift either the head of the bed or the foot of the bed, just put your bed in the foot of the paws of the bed in here, and it can be elevated. We have what they call a bed cradle. This one helps to relieve the pressure of the linen or the bed sheets from the patient. In case you don't want them to touch the patient directly, you can use a bed cradle. Next is a Macintosh. They be of different sizes. So a Macintosh is helpful in a way that it helps to prevent the mattress from soiling. Then we have smaller pillows and big pillows. So a big pillow can be used for comfort in case a patient feels like having that comfort of sleeping on a pillow or being elevated. It can also help in that way. And then you can still use it to relieve pressure. For example, where two body folds can meet, you can put it in between to relieve pressure or friction in between them. Next is the side rail. This one is called a side rail or a bed rail. They're always at the side of the bed to prevent the patient from falling off the bed. Then we have what they call a footrest. This one here, a footrest is helpful in a way that it can help a patient to prevent the foot from falling down. Yes? For example, in case you're worried of your foot falling like this, you just put them like this, and then they can be stable. And then we still have more other bed appliances. We have a backrest, this one here. A backrest is helpful in the way that it can help a patient in a sitting upright position. For example, patients who are having difficulty in breathing, yes, and they want to be in a sitting upright position, you put a backrest. Then you support it with some pillows for comfort. And lastly, we have what they call a fractured bed. Yes, board. A fracture board, sorry. This one can help to prevent malunion of any fracture. For example, if the springs of the bed are not firm, you can put it below, and then the patient can get a comfort position. Or in case a patient is having a fracture and you're preventing malunion or over movement, you can put it, since it is a flat surface. So those are our bed appliances. In case you get a question, feel free to ask, and feel free to come to the skills lab and have a look at them, touch them, feel them. Thank you so much for listening.